Hello, everyone. I'm Chris Bratton, founder of Bratton Law Group here in Southern New Jersey, and welcome to another episode of Coffee with Chris, where we provide you with information in the areas of legal, financial, and healthcare advocacy. I'm very excited to speak with my guest today. Melissa Mordecai is a doctoral prepared and nationally certified acute care nurse practitioner working in the field of geriatrics and post-acute care, who most recently was awarded the 2020 NICHE and ABIM Choosing Wisely Trailblazer Award. Her prior experience involves emergency nursing, clinical information systems, and pulmonary and allergy medicine. She's director of post-acute integration, building clinical relationships with local skilled nursing facilities and organizations. She's also an advanced practice nurse with Jefferson Medical Group Extended Care Practice. Welcome, Melissa. How are you?
I'm great. Thank you so much for having me this morning.
Absolutely. Thank you for coming on. I appreciate it. I wanted to talk to you today about caregivers. A lot of people are going through tough times now with the pandemic, but caregivers are having a particularly tough time being alone and shouldering the task of providing care. So let's first start with making sure we understand what we're talking about. So what's the difference between a professional caregiver and a personal caregiver?
So that's a great question. So I actually became interested in caregiver and caregiver stress back in 2016. There was a AARP report written called part of the CARE Act, and it talked about we have our professional caregivers, which are our nurses, physicians, social workers, home health aides, certified nursing assistants. But then we also had our family caregivers or personal caregivers. So those were the ones at home that were also taking care of either their children or their parents. And we've referred them in the past as the sandwich generation. So they're still taking care of their children, they're helping take care of their parents, but then they're also going to work themselves. And this report found that they at least dedicated 8 hours a day to family caregiving. So the role of the caregiver, pre-COVID was stressful as it is. And now that we have COVID and we're in the pandemic and, things are changing, this role has expanded. So everybody working from home and, caregiving has just expanded.
Give us give us a picture that the audience can relate to pre-COVID compared to now.
So, pre-COVID, we might have, the example of the medical daycares. So somebody might have an elderly, family member that they're caring for. They would get up in the morning, get their kids off to school, get their loved one off to the medical daycare, and then go to work themselves. Now, with things being closed and the services may not be, there may not be as many services out there. They now have their elderly or their older adult home with them and their children home with them, and they're trying to work from home. So balancing it all.
Right. That's a lot. It's a lot to shoulder. And, you know, I think oftentimes, caregivers are reluctant to say that they can't handle the situation, whether that may be due to guilt or something else. So how how can you identify caregiver stress?
So it comes in many shapes and forms. The biggest stress, looking if they're angry or they're irritable or decreased concentration, not acting like themselves. Those could be, indicators that there's some caregiver stress. There could be personal neglect, maybe not taking care of themselves and their needs, but then there can also be neglect of their loved ones, emotionally, or even physically.
Yeah. A lot of times there is that guilt there. They don't want to place them. They want to make sure that they're
Mhm.
um, taking care of that loved one. But that can ultimately lead to other risks. So how does a caregiver take care of themselves so they don't place themselves at risk? And in your viewpoint, what are those risks?
So prevention is key. You want to plan. So you want to always have a backup plan if, say, you were to get sick yourself and had to, have somebody come in to help you with either your children or your older adult. You want to make sure you're setting time aside to do things that you enjoy. So if you enjoy cooking, you want to make sure that you're cooking a meal a day. If you enjoy, exercise, you want to make sure you're fitting that time in, or making sure you're eating healthy. Take a hot bath. Just really have some time to yourself if that's what gives you what you need to regroup and renew. take when the weather's nice, not like yesterday, but today it's a nicer day. So, get out and take a 15-20 minute walk if you can, just to decompress and take care of yourself.
And it's okay to ask for help.
Yes,
right?
100%. Yes, ask for help. And if people are offering, take it. So, even if somebody wants to come over and sit with your loved one for 20 minutes, that's just something where, you can get some time to yourself.
So what can you do to help somebody if you think they're going through that and that caregiver stress is evident?
So if you start noticing that, you have, a friend or a family member and they're starting to show signs of caregiver stress, if you're able, offer help, offer resources. The other is, maybe, and social media is out there, and social media is a great thing, but also, maybe have them reduce their time watching TV or reduce time on social media, and just offer whatever help you can get. And one of the things that I did during the first wave of the pandemic is a lot of my friends and family are in healthcare and law enforcement, and that they're at the highest risk of getting sick. So I made sure, just something for me, is I reached out to people every day. I just picked 5 of my friends in the fields and just say, hey, how you doing? Everything okay? Just know that we're thinking of you. Our family is thinking of you. And I think that little extra step, I'm hoping made a difference.
Absolutely. Any little bit of help that you can provide someone, especially during these times, is great. I appreciate the information. I know you're busy, so I want to thank you for joining me today. Can you let everybody know how they get in touch with your practice, maybe if they have any questions or if they need assistance?
So that you can email me directly. So it's melissa.mordecai@jefferson.edu. And I can direct you to where you need to go.
Thanks, Melissa. And of course, if anyone needs to reach out to us for assistance, you can find us at brattonlawgroup.com or by calling our office at 856-857-6007. Melissa, thank you very much. We appreciate your time and your expertise today.
Thank you for having me.
All right. Have a great day. Take care.
You too. Bye-bye.